Now I want to take you to Senator Bill Cassidy. Thank you, sir. In Louisiana, you might have heard the sudden uptick in cases in Louisiana, particularly around the New Orleans area. They're having a devil of a time trying to explain how this sudden surge took hold, but trust me, it's taken hold. And the senator, a doctor as well, I might point out, joins me now. Senator, thank you for taking the time. What, first of all, is going on in Louisiana that all of a sudden seems to have boomed?
Orleans Parish has the highest per capita incidence of coronavirus or COVID-19 in the nation. That's higher than New York, higher than Seattle. They have more population, so they have more cases, but we have the more per capita, if you will. It's kind of been lost a little bit with the attention on the East and West Coast, but it's very real. And every day we have a dramatic uptick in the number of cases. We've asked the federal government for help. President Trump has pledged it. We're trying to get through it.
How is that going? I mean, we talk about supplies and what you're ready for, what your residents and hospitals, local healthcare officials are ready for. We know of extreme shortages in the New York area. They're trying to address that now. Even the president with the ship, being sent up from Norfolk, Virginia to do just that. How are local healthcare officials in your area handling that?
I'm told that we're almost on the verge of being at capacity, that we're trying to expand. The Army Corps of Engineers, I'm told, is building out a couple of field hospitals, and they're opening up other facilities to take people for quarantine. But we're bulging. We're about to overflow. And so if there's another mercy ship, we need to come to the Port of New Orleans, because we are at the point where we are going to need that for extra capacity. And I don't want our state to be lost with all the attention upon New York.
The stimulus measure went out, Senator, as you know, the $2.3 trillion. Already talked that more stimulus is on the way, or relief, whatever we want to call it. Can you outline what the Senate in particular is looking at?
Yeah, so personally, I would like to see first, we need a way to emerge out of the medical crisis. I had an editorial published yesterday in the Wall Street Journal in which I, as a physician who's worked with immunization programs, point out that if somebody has been exposed to coronavirus and recovered, the best thinking right now is that they're probably immune for at least another 12 or so months. So we need to start establishing an immune registry, if you will, so that those who are immune, we know who they are, and they can be the nurse's aide or the bartender. They can be the person who goes out and greets those, not fearing that they will be infected, nor that they will infect other people. And so we have to have that exit plan. With that exit plan, we can begin to restore commerce. Then I would like to see a very large infrastructure package, getting working Americans back at construction, pulling through manufacturing, which stimulates the service industry. If we can do that, then I think we have a long-term exit to restore the economic prosperity we had before this hit.
As a doctor, and from that vantage point, obviously the arc has not gotten to the point as it is in China, where there's been a reduction in cases and even a willingness on the part, in that case, the Chinese government to sort of reopen Wuhan and get some people back to work. In your gut, Senator, any idea when that could happen? The president has been intimating he'd like to see stuff like that happening starting, Easter Sunday, a couple of weeks from now. Probably unlikely. What are your thoughts?
There's a paper from the MIT which modeled that basically if you have an epicenter, you got to shut down that epicenter, that people cannot leave. If people cannot leave, then you keep from spreading the infection to other places. If we can do that, if we can shut down the spread of the coronavirus from where it's hot to where it's not, then we're going to, again, set the stage to begin to emerge. The cases on the ground will tell us when that is. If you still have people flooding the emergency rooms, we're clearly not ready. But when you begin to see that decrease in number of new cases and the emergency rooms empty out and field hospitals taken down, then we're there. Events have to dictate what we do.
Senator, thank you very, very much. I know you've had a crazy week. Thank you again. Good seeing you.
Thank you.